Internist conversation number 25. Internist says, every year the medical students and residents get a little stupider, and every year they care less about the patients. Me, what do you mean? Internist, they don't even want to talk to the patients. They just want to look at their labs, their imaging tests, and the computer, and then prescribe drugs based on that. Me, yes, all this high-tech stuff is overrated. It makes doctors think that everything is related to it. In reality, the vast majority of the patients, they all have the same diseases: obesity, hypertension, diabetes, coronary artery disease, cerebrovascular disease, bad teeth, and abdominal pressure syndrome, and quite often leaky gut. These are all dietary diseases. Internist. We have a pharmacist that goes on rounds with us. They ask her more questions than they do me. What the medical students and residents care the most about is learning the drug protocols. That's what they get tested on. Me. Drug protocols. What a joke. You can't cure a dietary disease with a pill. Internist. The system does not want to cure the patients. It just wants to manage them with drugs, to keep them on drugs the rest of their lives. Me. If they only go by drug protocols, then you don't need that many doctors. Internist. Yeah, I know. In the future, I think there's going to be more and more of these nurse practitioners, physician assistants, and pharmacists, and fewer doctors. And I think the pharmacists are going to be prescribing drugs as well. I just see it going that way. Me. People think drug medicine is high tech, but in reality, it's stupid. You could give a pill to an animal. You could do a surgery on an animal. Only a human can learn new information about diet and health and then voluntarily change their diet and their habits. Internist, I know. Me. You guys should invite me to lecture about my theories of back pain, neural degeneration, the role of mitochondrial inhibitors in disease, or the role of dental problems in disease, or the effect of estrogenic chemicals on health, things like that. And, toxins in non-organic food, things like that. Internist, that's way too advanced for them. They don't even know what a zeta potential is. They don't know what atherosclerosis is. They don't know what causes hypertension or diabetes. They don't even know the vocabulary on these topics. He says, I tried to teach them a little bit about nutrition, but they're not interested. Me, Nutrition is the only thing that'll help the patients, and the patients don't want it, and the doctors don't want to learn about it. What a joke. Internist. It all goes back to Genesis 1:29, where God said, I have put plants on the earth to be food for you. The first book all residents should read about nutrition is Starch Solution by McDougall. Humans are meant to eat starch. That's the most important thing to know.